The United States now has close to 1 million confirmed cases of COVID-19 and over 55,000 deaths. Much of the country remains under lockdown, and protesters are taking to the streets in multiple states to voice their anger over what they see as an infringement on their civil liberties and ability to make a living. Now, at some point, as deaths from the COVID-19 pandemic start to decline and the country is able to get back to work, economies will reopen. But if that reopening isn't done thoughtfully or carefully, it risks a second wave of COVID-19 infections. And the question is, what would that look like from both a healthcare and economic perspective? Dr. Rupali Lamaya, an associate scientist at the Johns Hopkins Bloomberg School of Public Health, says part of what is needed to reduce the severity of a potential second wave of infection is to establish a medical surveillance system as states open back up.
There has to be a surveillance system that is able to detect and then able to identify positive cases. So once they're identified, those folks can be quarantined and isolated. And then there also has to be contact tracing. And unfortunately, we're just not there yet in the United States. And that is the biggest issue, is that if we had a more robust surveillance system, then we might be able to manage it, but that we're not there yet.
Dr. Lamaya says that a big challenge from COVID-19 from a public health perspective is simply there are many things that researchers don't know. And that makes it difficult to determine exactly how states should open back up their economies.
My suggestion would be to do somewhat of a phased approach. Part of it would have to look at what does in each state, because as you know, each state is on a different curve. So looking at each state, looking at the number of cases that the state is essentially confirming every day, once that we make sure that that bell curve is way, way down, not just starting to peak and going down, that we know that there's less virus circulating within particular states, then we can start to slowly open things back up. And by that, my concern is that because people have been stuck at home, that as states start to open back up, it's going to be a little crazy that people are going to go out and are going to want to do everything. And again, I feel as though maybe it should be a bit of a staggered approach. That first, let's think about, opening parks, I don't know, right? And kind of then in another couple of weeks, again, looking at the cases, looking at what's happening and looking at the data, then maybe we can open up other things slowly. So
if a second wave of infection does occur and it causes an additional set of economic damage, how might Congress be able to respond? Here are some thoughts on that from Forbes staff reporter Sarah Hansen, who covers money and finance.
The government cannot print unlimited money. Eventually, the time will come when we have to reckon with how much spending the federal government does when it comes to programs like the PPP. And most people expect that that reckoning will come in the form of taxes down the line. For the first time in decades, the federal debt is projected to be larger than the entire economic output of the United States. So there's no doubt that we're spending a lot of money, and there's also no doubt that one day down the road we'll have to reckon with that spending.